Hi, and welcome to this seventh in our series of videos for frontline family violence workers and therapists during this rather complex time of COVID. Today we have a very special episode because in this video we're going to focus on supporting families and workers where there are people with a disability or developmental delay. Devoted viewers will know that this is a continuing collaboration between several agencies and individuals, the details of which can be found on the Centre for Excellence in Child and Family Welfare website. And as always, we'll be giving you a link to a whole bunch of information and resources at the end of this video. First, we would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to lands, waters and communities. We would like to pay our respects to Aboriginal and Torres Strait Islander cultures and to elders both past and present. So for a very special episode, we have a very special panel with one return visitor and two new faces. So we'll start with the familiar. Welcome back, Karen.
Hi, Nick.
Just tell us who you are, Karen.
Sure. I'm a child and adolescent psychiatrist and I've specialised in working with children under the age of 5 and their families. And I've worked in different sectors. Currently, I'm mostly in private practice.
Thank you. Lovely to have you back, Karen. And we have Jodie Barney with an Auslan interpreter, Brooke, working with her.
Good afternoon, everyone.
And Jodie, just tell us what your background is, your agency, where you're from.
So I'm a proud deaf Aboriginal woman from southeast Queensland. I now live in Victoria, and because of COVID, I'm in quarantine. I can't get out of my house. I'm stuck here. So I have a private consultancy business discussing with Aboriginal, so all age groups. My passion is working with youth and children, making sure that they have access to community and the needs that they have access into community for the Aboriginal people.
Thank you, Jodie. Lovely to have you with us today. And our third panelist, Kristin Pringle. Welcome.
Thank you, Nick. And my name's Kristin and I'm an occupational therapist, a mental health clinician and a yoga therapist specialising in trauma-sensitive yoga. I've worked in a number of different sectors, both public and private, and I also am a university tutor and lecturer at Monash University in the occupational therapy department. So I work in private practice on the Mornington Peninsula where I see clients a couple of days a week, and I'm an external supervisor for multiple family violence organisations, nursing organisations and family care organisations.
Oh, well, welcome and thank you very much for joining us today. My name is Nick Carr. I'm a GP writer and broadcaster. So it's now September. Lockdown feels like it's been going on forever. And even though there seems to be some light at the end of the tunnel, we still can't really see how bright that light is or how much more tunnel we've got to get through. And we know it's been a tough time for everyone, but for some it's much, much more so. So Karen, I want to kick off by asking you, how do you see the situation at the moment, particularly considering families where there's a disability?
Thanks, Nick. It's really exciting to be part of this panel today, and I'm hoping that I'll learn a lot from the other panelists as well, and that we can really offer something new for the listeners that will help the families that we're here for. So I guess one thing that I'm very aware of is there's poverty in Australia and there's inequities. And people with a disability are more likely to face multiple barriers to accessing the kind of assessments and care that's actually going to promote their health and functioning and help them be the best parents they can be for their children and connect with their families. And I guess I have a lot of concern at the moment about children who have developmental delays or differences and would really be benefiting from those being well understood so that they could access quality intervention, that their parents could be really supported to promote their development, and also the increasing risk at the moment of family violence, and that we know that people with a disability are more likely to experience abuse in childhood and adolescence, and that are more likely to have high levels of distress, psychological distress, and that there's increased rates of intimate partner violence as well. And I guess when people come to see someone like me, often there has been different types of abuse where they may have a pattern of polyvictimisation and they're struggling with trusting to engage with different people, and they're going to tell me things if they think that's going to be helpful for them. And I guess thinking about people where there's intellectual disability, perhaps an acquired brain injury from maltreatment or substance misuse or a stroke, or they have a psychiatric illness which is resulting in a level of disability where they're having difficulties taking care of themselves and fulfilling their roles. So these are all kind of issues that I think about and how that impacts on perhaps people feeling scared, ashamed or powerless at times, and how we can reduce their fears and how we can be helpful to really help them meet their goals.
And a question which occurs to me as soon as I hear that, and this, I don't know if you have an answer to this, but do we know whether in this complex time of COVID, these problems have in fact been worse? Are there any data that tell us what's been happening? I'll throw that open to anyone.
I can't tell you data. I think one of the things that people are predicting is that people are going to come forward as things open up. Some people have told me that they're finding they prefer to be with me in the room face to face, but they're also finding the teleconferencing and the phone calls quite helpful. And it means that they're not having to travel. And sometimes when there's a family violence context, it actually gives them more flexibility and privacy because they can make phone calls where they're less likely to be monitored by a perpetrator. So there have been some advantages. Also where I've been able to see into people's homes and see the child in terms of their typical day. I get to see the challenging behaviours as they're happening and help actually engage directly with the child during it when they have some language to do that and support the parents. And while I'm sitting here in my room, I've got this range of toys here, for example, I've got to show you here. So I've got, I see a lot of children with autism spectrum disorders. So lots of things like this that I bring into the sessions. Children quite enjoy that. So there are actually ways of engaging children through the screen, and I've been pretty impressed with that, and they like to show me their toys as well. So.
That's actually interesting. I wouldn't have thought necessarily that toys which you can use in the real life circumstance you can actually use on Zoom. I love that.
Oh yeah, and the other thing that's like little toys like this, but pets. So often my cats here, children love to show me their pets, and pets can be an incredible way of grounding as well and building that trust. And when we have that trust in our therapeutic relationship, it can really help people enormously, I think.
Yeah, I've got Sam in the background here, keeping me safe and trustworthy. Kristin, could I turn to you? How do you think we can help support children's development at home and promote their good functioning in this complicated period?
Yeah, there's numerous ways. As I think sometimes when we're experiencing occupational deprivation and isolation, which many people are at the moment, especially in states in Australia that are in lockdown, such as I'm coming from Victoria, I think that is a huge thing, is the deprivation of sensation of natural environments as well for children and parents, and occupational deprivation. Things just kind of get stuck for many people. So realising that, I think that families do have absolute expertise in this, and kind of reminding parents and families and grandparents of different ways of actually connecting when it is so difficult, being in isolation, and that there are things around their house that they can use to increase that sensory stimulation. So sensory stimulation really gets taken away from many children and many families when we are unable to access a natural environment, unable to access therapy, unable to access schooling. And all of this is currently going on in a magnitude in different areas. So it's looking to things like, you don't need to buy necessarily an expensive shaker. You can get a bottle, you can fill it with rice, you can screw in a lid, and that you can actually shake that, and that can also then be used as a roller, and that can then be used as, you know, a drumstick. So all these kind of things that we, because of the deprivation, really thinking of that traumatic growth and bursting that creativity and thinking, what do I actually have around the house that I can use? Play-Doh we can make out of flour, leaves we can use in the garden, or feathers from a drop bird. And these are all the really important things to increase that sensory stimulation at this time for families.
I love that. I love those examples. Anyone got any other examples of what people can use at home that's readily available?
Yeah, for myself, working a lot, we communicate a lot online, and it is quite difficult, and it's a very new experience for a lot of Aboriginal children. It's the first time. Sometimes they've never had access to an iPad, or they've never had access to technology. So making small videos, like clips of sign language, and teaching the alphabet, or showing different fruits and the signs for fruits. So we can actually use that and pretend. We can ask questions. What fruit is this? Yes, that's an apple. So the kids can actually see that facial expression, and it's like, what do you have? And the children will bring all different things to show you on the screen. Look, and it's like, what's that? And then I give them the sign for it. And so it's really quite fun, and it's really quite interesting to see how the children actually connect through a different way. And it's really valuable for them. Or they might bring their dog or their cat across, and they'll show me, and the cat sort of, and it's like, poor cat, and the dog, and the cat's almost strangling and things like that, but it's great. So they can actually show me things. Yes, they're in isolation, but they can actually show me things via technology. And it's really important that you can explain things like making sure social distancing, making sure you're wearing a mask if you have to go outside to the shops. So visual communication is absolutely the key in this sort of environment. And it helps to settle them and calm them as well.
So can I ask Jodie, working with Aboriginal communities, particularly with high rates of developmental delay, what sort of issues have you seen in that sort of community at the moment?
So right through COVID, we've had a lot of families absolutely in awe that how bad it actually, my children can't write, they can't read, the development is getting further and further behind. Sometimes it's the first time that they've actually had homeschooling. So, and the parents have no idea on how to teach their children. And so the teacher may ask the parent, and they say, my child can't understand the alphabet, my child can't understand language. And the parent's like, and it's the first time that they've actually realised there's a delay in that education. So the families have actually got to accept that, and that they're missing out on something, or there's something, their gut feeling, they know that something's not right with their child. So a lot of families, it's the first time, because they're spending so much time with their children, they actually have to focus. The child actually has to focus, and that delay is actually more noticeable because they're with their children a lot longer. So we've seen those type of delays.
And Jodie, what are the sort of barriers for Aboriginal families who have got kids with either a disability or developmental delay? What are the barriers for them at this time of COVID?
Access to important services. Sometimes they don't know how to find the right person, the right professional, or the right service to actually help them. They've got no idea. So it may be hearing loss. So do they go to a speech therapist, or do they go to someone in relation to the developmental delay? Do they see an OT? Do they go to the allied health service? But who do they actually see? And trying to find that right person to be able to make that decision about who they see. Do they go to the GP? So, and they actually don't know how to contact those services. So there are a lot of barriers. There's also poverty. poverty issues happen a lot with families, and they actually don't know how to connect to those services, and finding the right access point to actually get through into those services. So, and there's a lot of new families that are in lockdown at the moment, and it's the first time they've actually meeting with therapists and things like that. So you have to try to explain to them the process of what we do next. And so what the therapist will actually do, what the therapist can offer, the expectations of themselves and the expectations of their child. So we're finding the appropriate service providers as well. Do they have Aboriginal speech therapist? Or do we have an Aboriginal OT? Do we have an Aboriginal physiotherapist? And where are they located? And how do we find that information?
And sadly, I imagine often the problem is that finding that kind of assistance is very difficult, is it?
Oh, yes. So it can be, and sometimes it can make the family feel very overwhelmed, shame, that how do I deal with this? I don't know what to do. How do I get the information, and how do I go through the right channels? So a lot of the Aboriginal health services and the allied health services, so they will email resources to the family so they can do their own research. But at the same time, the children are in the home, and it's a busy household at the moment. You may have children running around all day because you've got homeschooling going on and things like that, and they don't have that time to be able to read that information online. So sometimes people will contact me, and I will actually ask, where do you live? And so I will actually send them some information so they can actually have it on paper and some information. So some books. You can actually make an appointment with this person. So they may not accept new professionals. So sometimes professionals have actually closed their books because they are so overwhelmed with so many clients. So, and we're finding that an increasing problem at the moment, that a lot of organisations are actually closing their books because they just have too many clients. And it's the same with the NDIS process as well. So I'm doing a lot of work with the NDIS at the moment in my area as well.
So, Kristin, hearing this, hearing how complex it is and the lack of sometimes appropriate resources, I presume this work is then sometimes going to come back on people who are not specialists in this area. Is there anything we can do to sort of help advise, give people some tips about how to work in this space if this is not actually their specialist expertise?
Yeah, and that's happening more in my experience, Nick. I've actually had multiple organisations contact me for consultancy. So coming in knowing that they may not be able to possibly get an OT, or may not be able to get a speech therapist or psychologist. I agree with everything that's being said, that people are really beyond capacity in a lot of ways at the moment. And so reaching out, I think, to people to do a bit of like train-the-trainer consultancy work, that transdisciplinary work where we're actually sharing our expertise with people, and also encouraging the things that we actually have similarities around as well. There's a lot of the allied health professions and medical professions, there's so much similarity in what we do. We have different frameworks around it, but how we can actually use everyone's strength so using a little bit of consultancy work, which I know that's been a huge amount of my increase actually in work, has been with consulting to different agencies around occupational therapy or infant and parent mental health or somatic therapies, whatever they're kind of using me as a resource for. And to the earlier point as well, Nick, there's actually quite a lot of research going on in the disability sector at the moment around COVID. So we might be able to add that too as well at the end of some of the resources, specifically with the Royal Commission into Violence, Abuse and Neglect with people with disability. There was a public hearing which also looked into experiences of people with a disability during COVID-19, and a number of disability advocacy groups have been so inundated with requests and information. There's a lot of really great resources, but I agree with Jodie, it's all online, because that's how we're working, and people get overload of things being online. I agree that, you know, there's people in roles at the moment where if they have multiple children or multiple generations in the home, the younger children are maybe not being seen as much because so much effort's going into the school-age children, because it is a really difficult job to put the hat on of a teacher support. It's complex times we're in, and so yeah, there's an abundance of people doing their best to assist.
And one of the things that's come across in other conversations we've had like this is that question you're talking about, Kristin, about interdisciplinary collaboration, more cooperation between agencies. Karen, I don't know if you've got any extra to comment on that, because this seems to be like a recurring theme when we do these videos.
It is, and I think one of the things that I've done a lot of professionally is be part of a care team meeting where I offer a consultation like Kristin was talking about. And that's where the different providers and family share their observations about the child's development and the challenging behaviours, and the kind of the puzzles put together, and people clarify what their roles are, because often there's a lot of confusion and speculation that's going on. And people talk about mental health issues and they don't really understand what's going on for each family member, and also what's happening in the different relationships. And high functioning autism is something that's often missed, as well as traumatic brain injury. So one of the concerns that I would have is that children end up having their challenging behaviour as the central focus, and people aren't understanding the meaning of that child's behaviour. That behaviour is actually communication, and that you can actually observe very subtle interactions between parents and their children, which are repeat, and it's their typical dance that they have. And that tells you a lot about what's actually going on, and helping the parent recognise how they're responding, and to do it differently, where they're actually reading the child's cues more accurately, they're responding with more kindness, they're having less of a sort of traumatic reaction where the child might be frightened of them. That's enormously important. Because the other thing that I think services are struggling with is offering the tangible help that normally when we're doing the face-to-face outreach work, there can be that tangible help taking people to do things. And I think I'm expecting, and I'd like Jodie's ideas about this, and Kristin, what you've heard, that there's just greater barriers for people. And some parents don't know how to use email, they don't know how to use the internet, they don't have good devices. And it's really, really hard for them supporting any remote intervention. And often those people prefer a phone call. What do the others think about those ideas?
Yeah, there's a number of clients. Being an occupational therapist, we do equipment prescription as part of it. So there's a number of, especially through like people who have NDO supports, who might be getting new laptops or new iPads or new phones or new computers, but there's no infrastructure to help someone turn it on, or how do you operate it, or how do you transfer your data across from one to another. That's a lot more requests that in services I'm getting for things that maybe would have been someone going to the home or being able to do that, or you're able to go to a shop and someone was able to help you. There's also a huge fear around people coming into your home when you've been in isolation for a long time. So there's a real restriction as well with different support workers unable to come into people's homes as well, because there is a valid fear of you know, what will happen if someone I don't really know comes into my house, and that might put my children and myself at risk. So there's many families who are really doing it solo without the necessary supports, especially in disability services, where there may have been, not always, but there may have been more access to support workers doing outreach visits and taking people to appointments. That just is so low on the ground because of the multitude of complexities.
And Karen, I heard you say you wanted to hear Jodie's take on this. It was a while back, Jodie. I hope you can remember what the take was.
I think it's really important that access to communication is vital. Our community is very broad. So there's different language delays, there's different language supports are involved, there's different types of communication skills. Some people need written, some people need audio, some people need easy English. So, and with the Aboriginal community, I use a lot of mime because they may not have the Auslan skills. So we're trying to establish that language between each other. And so, and making sure that you have deaf positive role models that are involved with those people. So, and trying to understand that and trying to help support their communication to make sure that it runs smoothly and not sort of jumping around to different types of communication. So making sure that we find the right access they have. And there's many communities that have Facebook, they have Messenger, they have Instagram. So they have access to mainstream media, it might be Zoom, it might be Skype. So making sure that if they have some type of sharing, the one way to receive information, it might be a video, it might be on the internet, it might be a cartoon and a form of editing cartoons that will actually help that families get that support. So, because a lot of the time the families will not say anything, they'll just keep everything quiet. So there is an increase in family violence, and we know that through the coronavirus, and there's also that fear. So the community needs to access to communication, and they need access to something to be able to get something, because for them to continue without getting anything, they become more passive, and they actually will wait for coronavirus to finish before they actually access anything, and then they become absorbed in their own behaviours and things like that. They don't go outside, and they get used to keeping quiet, and that trauma gets put into the back of the head, and then they have more trauma and more trauma and more trauma because they're keeping quiet for such a long time because they're waiting for coronavirus to be over. Isolation is a really big issue with NDIS spaces at the moment, because now a lot of families are finding it really difficult with their children. The NDIS are looking at how the behaviour management plan is working. So they actually don't need, they look at them and go, they don't really need support because they haven't really used the NDIS package. But it's because of coronavirus, they haven't been able to use it. And it's not because they don't need the support, it's not that, it's because they haven't been able to get out into the community to actually use their funding. So there's that trauma in the back of their mind that their funding will get taken away. So some families are worried about their funding for NDIS plan will actually stop or be reduced because of COVID, because they're actually not involved in the community at the moment because of COVID. So we need to have the Disability Royal Commission. I'm actually I'm part of the First Nations advisory group for the Royal Commission. So we have to get that information about coronavirus out into the community for Aboriginal agencies as well as in Aboriginal services, where people can actually get that service and get that contact. So in Victoria, the Department of Health and Human Services, DHHS, I'm part of their COVID advisory group as well. So talking about access, making sure they have access to the disability tile, and making sure that there's information on their website about that. So, and making sure that it's in easy English, it's in Auslan as well, and making sure that people can actually access that information. So they're putting a lot of information, a lot of announcements, and making sure that information and those announcements are actually accessible. So I don't know if I've answered the question. Maybe I just went on a bit too long there, but hope you got something from that.
No, that was fabulous. Thank you. And I want to come back to you in a moment, Jodie, to ask a different question, but I just want to pick up on something, Karen, that you mentioned, and I'm going to ask all three of you if you have any suggestions with this, because Karen, you said one of the things that happens is that you've got kids, maybe someone on autism spectrum disorder, acting out. We need to try and help those families understand that behavior as information communication. How do we do that? We're not even in the room with them. You've got parents who are frazzled, we've got a child with a disability who's behaving badly, everyone's cross. How on earth do we help them understand this?
Well, right from the start, I explained to parents that we're here to understand their child, and that we can actually learn a lot by observing their child. And I take time to hear the story of how the difficulties have developed and to get to know the child. And in the session, like having these mobile devices, we can actually follow the child around the house, not in an intrusive way, but you know, they might have some time to be in their own space, but we can actually see how it all unfolds. And I can talk to the parent as it's happening and kind of coach them a little bit to kind of understand it, to help the parent calm down. I can speak directly to the child in a way that might help calm them. So we can actually do some little experiments with what might help the child in that situation too. And sometimes if there's two caregivers there, one might go into a room and talk to me while the other one's monitoring the child's safety. Okay. And the parent that's with me might kind of debrief about that experience as well. And yeah, I calm them down, we go back and we engage with the child again. So I think it's really important to have anything that we're doing centering on the child, because children are less visible in the communities at the moment. People don't know them as well. And I think we also need to check on our own assumptions and not speculate. We don't have all the information at the moment. And there's enormous childism in Australia. And I'm really hoping that that's going to change at some time. That's going to take political will to invest in children, particularly those children.
What do you mean by enormous childism? What does that mean?
I guess intersectionality. So all types of discrimination are seen the most in the children living with poverty. Jodie's nodding there. Do you want to comment on that, Jodie?
Yeah, I agree. I see where there's a lot of socialization, but they forget about the children. They actually don't look at the behaviours they're having. So they don't actually watch what's actually happening, what sort of support they actually need. So the children might be in the community, but the adults are talking to other adults, and they're almost ignored. So, and it takes a long time for them to be able to, they need to be observed as Aboriginal children. So they don't have the language to say why this is happening. So they just observe. Children just observe. They may not have the language to be able to communicate what they're saying. So they're taking in information, they're observing information, they're observing behaviours. So, and they're taking in information, situational information. So, and we have to recognise that that's really important.
So I'm going to ask you a tricky one here, Jodie, but if we accept that a lot of people watching this are not going to be specialist workers in disability, but sometimes are thrown into that space, I'm going to ask you if you have any very specific do's or don'ts for people. And an example I will give you is my mother, who was an expert in Down syndrome. Her research discovered that what parents didn't like was people saying, oh, your baby's got Downs. They just wanted people to like their baby like any other and say, what a beautiful little boy, that sort of thing. And that simple piece of information was really important for me as a doctor, because it meant when someone came in with some disability difference, rather than being all medical and saying, oh, your child or your partner or whatever has whatever it is, I knew not to focus on that. It was a simple, really helpful piece of information. So I'm putting you on the spot here. Any little tips or advice like that about what workers should do or not do when working with disability and developmental delay?
Myself, cultural awareness training is really important for the staff. So to always say that in the community, you want to get a support worker into the house or whatever the situation might be, that person that's working with the Aboriginal family is a person. You don't need to focus, sorry, the person needs to focus on the positives and not focus on the negatives, not give them a name. People in the community, or Aboriginal people in the community, don't have a label. They don't have a word for disability in their language. There is no word. For me, I didn't know I was deaf until I was 8, because I just accepted that I was just who I was. I used a visual language, and it was passed on from generation to a generation. It was just accepted. There was no word for disability in our language. So I think that disability is not the negative. It's the attitude that's the negative. So if you need to work out the right way of working with particular clients, find out what their needs are and find out about them. But really, and ask that person themselves, what do you need? What do you like? You tell me how I need to communicate with you.
Kristin, I can see you nodding like crazy. Have you got anything to add?
Yeah, those are pearls. With Jodies just, and it's the same. It reminds me of when I started out as an occupational therapist, and I was younger, and I brought like this. You see these young OTs or young therapists going to outreach visits, and they've got a whole bunch of things to take. And then the more experienced you get, you come with yourself and because it's using what is actually in their natural environment and knowing that this person is the expert of their experience, not me. And it's being a facilitator of, or having a collaboration and a relationship to see how we can assist, because the experience is actually in the child and the family. Even when there's significant deprivation, there's always strength somewhere that you can find, and always, always, always in children. So I think that coming back to real basics of asking people, as Jodie said, I would reiterate, not as eloquently, but what as Jodie's actually illustrated there as well.
Yeah, it's a thread that's come through again before, is that particularly in this complicated time, we can't expect workers to be experts in everything that they're going to be thrown into, and that it's okay not to know, and the best approach, if you don't, is to ask. So I think that's something which as professionals sometimes we struggle with, because we think we have to know everything. I've been in general practice long enough, so I know almost nothing the longer I work in the field. Jodie, the thing that has completely sidetracked me is hearing that you didn't know that you were deaf until you were 8 years old. I would like to do an entire video sometime about that one topic and that experience. But sadly, we're not going to be able to do that today, because time has got away with us, and we will have to finish. So hang in there, and perhaps we can get Jodie's life story and hear about that another time. But to everyone who's watched, thank you for joining us. Please stay online and give any feedback you have, and leave questions that you would like to be addressed in any future video. And as was mentioned before, you will find a whole host of valuable resources available at this event page on the Centre for Excellence in Child and Family Welfare website. So that just leaves me to say thank you to our wonderful experts who've given up their time to do this today. Karen Gaunson, give us a wave.
Thanks, Nick. Yep, thank you. Thanks, everyone.
Jodie Barney, I want to wave from you. Thank you. And Kristin Pringle.
Thank you.
Thank you so much. I've been Dr. Nick. Thank you for watching, and we look forward very much to having your company next time.